السلام عليكم. الصوت والصورة واضحة؟ تمام. السلام عليكم، معكم من جود العبد اللطيف، سنة رابع، واليوم نتكلم عن وظيفة عضو مهم جالس وسط الدماغ، نسميه العقد القاعدية بالعربي or the basal ganglia. من اسمها basal as in reflecting the location of the nuclei في ال basis of the forebrain or the يعني تحت في النص. However, لما نقول كلمة ganglia it's actually a misnomer، مصطلح غير صحيح علمياً. Since the term, if you remember, ganglia is quite limited للنيورونز اللي موجودة في ال peripheral nervous system، لكن بنتكلم على النيورونز اللي موجودة في ال central nervous system المفروض إنها تسمى nuclei, so basal nuclei. However, الاناتومست تعودوا على هذا الترم وقاموا يستعملونه لفترة طويلة وقالوا ليش نغير الحين؟ فإحنا بنتعايش مع الموضوع هذا، وبكذا نبدأ. هذه النقاط اللي بنتطرق لها اليوم بإذن الله. ومن المحاضرة اللي قبل شوي حنين ما قصرت وشرحت كل ال definitions والterms المهمة، بس إذا في أحد فوت نقطة ولا شيء this is just a pure reminder. عندنا إحنا the basal ganglia is a group of structures that is hugging the thalamus. As you can see, this is actually a fictional drawing I sketched because I believe the structure is quite similar to the Pokemon Mew, which helps me remember it by heart. So we can see here this putamen, and that's the caudate or the tail, is hugging the thalamus. Now, caudate or coda translates into tail, and it represents the tail في نفس الصورة. And it ends with a ball-shaped end, اللي هي الأميجدلا, which is part of the limbic system في محاضرة بكرة إن شاء الله. Now, the putamen, along with the caudate, it represents something we call the neostriatum, أو sometimes يختصرونها ويقولون striatum. وهذه اللي بتكون محاضرتها اليوم. But it's also worth mentioning إن عندنا globus pallidus, and together the globus pallidus with the putamen represent the lenticular head. We also have two other structures نتطرق لهم في ال indirect وال direct pathways, subthalamic nuclei and substantia nigra, which we'll dissect further as we go along. Here another picture that's a different illustration from different fields. We have this frontal section. The caudate as we go كذا شريحة باي شريحة من مقدمة الرأس إلى تحت it will go and تنزل بعدين تلف مرة ثانية عشان توصل للtemporal lobe. تمام. Let's start with a real life scenario to understand the importance of theoretical knowledge عشان to back up our clinical judgment متى ما احتاجنا. Say a 61-year-old man suddenly developed uncoordinated movements of the trunk and the right arm. The right upper limb would suddenly, vigorously, and aimlessly be thrown about, knocking over anything in its path. أي شيء في طريقة لأن اليد كده بترمي بالهواء. From the past medical history قالوا لك يا دكاترة أن this patient was recovering from a right-sided hemiplegia secondary to cerebral hemorrhage. It might seem advanced, but believe me when I say that we will go back to this case at the end of the presentation and you'll hopefully answer without any hesitation. The motor control is quite complex لأن the brain, the spinal cord وحتى العضلات كلها they all partake in the process. But to put what happens simply and to understand what happens in the brain, that the brain cortex or the motor cerebral cortex takes its input, processes it في النيوسترياتم ألا وهي البيوتامين and the caudate. بتلاحظوني أعيدها أكثر من مرة بس عشان ترسخ في البال. And then it will send it off to the thalamus for coordination, which in turn will signal to multiple structures, including the cortex, عشان to allow or reject a movement. ولما نتكلم عن movement control, فإحنا نتكلم على 4 main circuits of movement. The motor, or the putamen, which is concerned with the learned movements. The cognitive, or the caudate, which are responsible for cognitive control of sequence of movements, which is basically the motor intentions. ولما نقول كلمة cognition, then we mean integration of 2 things. The sensory input of the brain plus the information اللي already stored في memory. فإحنا بهذا وبنتطرق لها in depth. Limbic loop, النوع الثالث, is involved in giving motor expressions, however, to emotions, like smiling or crying or having an aggressive or submissive posture via the nucleus accumbens, the reward circuit. وهذه برضو بتكون في محاضرة بكرة إن شاء الله. Finally, the oculomotor loop, which is concerned with the voluntary eye movement. الحين when I tell you to look at the screen and look at something that يعني قريب منها جنبها, for example, and then look back at your screen, your eyes, the pupils, both of them will move نفس السرعة وبنفس الرينج من الشاشة إلى الشيء الثاني المقابل. والمسؤول على هذه الحركة الvoluntary it's the basal ganglia. ونسمي هذه الموفمنت إذا بنتكلم على examination wise saccadic or rapid eye movement. بس إحنا بنتطرق على الأول اثنين in depth. First, let's learn about the connections between such structures. وبعدها بنتطرق we will discuss what is exactly being communicated between them. They begin mainly في premotor area and the supplementary areas. Ignore the text هنا, بس focus على الصورة معي. So we'll have the premotor and the supplementary areas as well as the somatosensory areas of the sensory cortex. They will send signals to the putamen bypassing the caudate. Now I would like to ask you something. كده brainstorming شوية. Why do you think we need to include communication of the sensory إذا كل محاضراتنا بتتكلم على الموtor movement? Give me your wildest guess. We need sensation when we're about to make a move. That's fine. Well, it's as simple. Oh, nice. Yes, it's voluntary. That's one thing. Another thing is that إحنا قبل أن نتحرك ونسوي حركة لازم نعرف مثلاً when, okay, we're about to take our leg and move it مثلاً forward. When مكان الساق الحين? And where should it land next? فإحنا we need to understand a sensation of its place, which we call the proprioception, and then we need to know when بتروح next. So yes, thank you, Rima. بعد ما راحت للputamen bypassing the caudate, it will go to the internal globus pallidus. وهنا بتلاحظون في arrows كثيرة, بس إحنا بنركز على الخطوات الأساسية وبقول لكم ليش في arrows تنزل تحت في arrows فوق. بس هالحين نتركز على structures. So from the putamen to the globus pallidus, it will go to the thalamus and finally return primarily to the primary motor cortex. Some will go to the premotor and supplementary عشان to correct the movement and make it as graceful as possible. يعني باختصار, the putamen circuit has its input mainly from parts of the brain adjacent to the primary motor. يعني رايح من قدام عشان premotor supplementary ورايح ورا عشان somatosensory. بس output حقها mainly go to the primary motor. خلينا نقول مثال as a function executed by the circuit, وهي كتابة حروف الهجاء. When the basal ganglia sustains serious damage, the cortical system can no longer provide the patterns حقت الخط حقت الإنسان هذه, فيصير الهاند رايتنج حق الشخص كأنه أول مرة يتعلم الكتابة, فيصير الخط very crude, swiggly, ثقيل وكبير. Other examples of learned patterns of putamen circuit مثل لما نجي نقص البيبر بالسيزرز, أو when we're hammering a nail, we don't have to think about it, إحنا تعلمناها, and we just have to watch out مثلا in case accidents لا سمح الله تصير. تمام. The connections between the caudate nucleus and the caudate circuit عفوا is quite different from the putamen. والسبب يرجع للاناتومي حقها. As you remember, زي ما قالت حنين, it has this C-shaped structure which gives it an advantage because it goes للfrontal بعدين للparietal occipital loops again to reach the temporal. فهذا يعطيها physiological advantage لأن it will receive large amounts of its input من ال association areas. لما نقول association areas, we mean hearing, we mean listening, vision, taste. كل هذه ال areas will integrate into different types of sensory and motor information into usable thought patterns. فبعد ما the signals will pass from the cerebral cortex to the caudate nucleus. Now the caudate nucleus is involved. It will go into the globus pallidus and from there into the thalamus. نفس الخطوات, but with the slight changes. من the thalamus, it will send it to the prefrontal area, and this is new because we are يعني the prefrontal area is responsible for cognition, personality, and choices. It will also send fibers and connections to the premotor and supplementary area, again, to correct the movement and make it as graceful as possible. لكن almost none of the returning signals will pass directly to the primary motor cortex على خلاف putamen circuit. A good example of this phenomenon is actually when a person sees a lion approaching. To respond instantaneously and automatically, they will first turn away from the lion, يبدون يركضون, and they will even attempt to climb whatever that is there, يعني مثلا سيارة, شجرة, أو حتى لمبة. And these steps happen subconsciously within seconds لأنه ما يحتاج لها ترتيب. And يعني مع أنها يعني a complex goal, but the caudate circuit is responsible to achieve that, even if it lasts for many seconds. تمام. Now let's move into احنا تعرفنا وش structures, عرفنا الخريطة حقتها. We will talk about what is exactly being sent and received between such connections. ألا وهي neurotransmitters. Now, these neurotransmitters are implemented inside two coexisting pathways that work simultaneously. As you can see, the word direct is in green with an upward going arrow, as if to give the command a green light and stimulate the end result. And the indirect pathway does the opposite. So you might wonder, how come they work together if they're opposing in directions? Well, imagine wanting to lift your arm up. The biceps would be stimulated to contract, while the triceps will be inhibited to relax عشان تصير الحركة بكل سلاسة وما يصير كلهم contract at the same time واليد تصير very stiff عفواً الذراع تصير very stiff وما قاعدة تتحرك. We need both. But let me ask you this to freshen up your memory. Can you type in the chat, what neurotransmitters do you know of? I'll start. Dopamine. Give me any neurotransmitters. Acetylcholine, that's nice, Nora. Can you give me another one? Serotonin, dopamine, yes, amazing. Okay, epinephrine, ما شاء الله خلاص بتخلص عليه المحاضرة كذا. طيب, احنا لما نجي نتكلم على neurotransmitters we group them into excitatory and inhibitory, واللي عليها bold هي اللي بنتطرق لها في ال two upcoming slides, and I would like you to really focus with me. تمام. The direct and the indirect pathways coexist. هذا اتفقنا عليه and we established it. But what do they exactly do? Well, the direct goes into these steps. The connections عندنا from the cortex go into the striatum اللي هو البيوتامين والكودate. They release excitatory glutamate. خلنا نتفق في البداية على شيء. In this diagram, green means excitatory, means glutamate أو dopamine. Red, it's GABAergic neurons تطلع لنا inhibitory. تمام؟ تمام. الكونكشنز من الكورتكس قلنا بتروح للسترياتم وبتطلع لنا excitatory glutamate. لاحظوا أن المسارات من وإلى الكورتكس تفرز وتستقبل glutamate. طيب, this striatum will also receive dopamine that's coming from the substantia nigra pars compacta that will act on D1 receptors. ولما نقول D1 focus هنا لأن في اختلاف بسيط مع indirect pathway. And it will have two excitatory signals coming from both sides, which will give it enough power to go all the way to the globus pallidus interna, bypassing the globus pallidus externa. الطريقة اللي أحب أفهمها فيها أن القوتين المشتركة هذه أعطتها قوة كافية لتحفيز الجزء الداخلي مباشرة. But now, the globus pallidus interna will in turn have an active release of a GABA inhibitory neurons. لأن إحنا لما نتكلم على البيزل جانجليا GABAergic in nature. فإحنا لما نحفزها هي كأنها وش بتسوي؟ بتحفز التطبيق. فإحنا الحين حفزنا striatum طلع لنا GABA ثبط الجلوبس pallidus interna. globus pallidus interna مثبطة الآن. فما راح تطلع كمية كافية من المثبط حقها هي. فكأننا الحين إحنا ثبطنا المثبط فبالتالي نزيد التحفيز. In physiology people like to use a fancy term we call it disinhibition اللي إحنا كأننا نشيل الانhibition هذا from the thalamus. Now the thalamus does not have enough inhibition and it will release glutamate back to the cortex. So as a net result, it will increase the motor activity والحركة تتم أو عضلة القبض. And as a clinical association هنا, the loss of dopamine neurons اللي جاية من substantia nigra pars compacta, such as with the cases of Parkinson's disease, would lead to lack of movement or poverty of movement. لأن الbalance between the direct and the indirect pathway كأنه tipped لصالح indirect pathway فيصير في global inhibition of motor cortex areas. And I'll tell you how in a second with the indirect pathway. طيب في المسار الغير مباشر the signals go into the subthalamus. Now the subthalamus here is included على خلاف هنا كان ما لها دور بالقصة. And then from there it will go back to the globus pallidus and from there it will go to the thalamus. ففي لفة بسيطة هنا. That's why it's indirect. طيب هنا we have the similar steps with very mild changes. The striatum here is affected by two opposing signals, the excitatory cortex and the inhibitory substantia nigra. It will release dopamine. However, this dopamine will work and attach to D2 receptors, which are inhibitory in nature. And from there, we'll have the net result as excitation, but it's not enough to go all the way to the globus pallidus interna. It will only go to the globus pallidus externa. And from there, it will release less GABA, فكنا نزيد التحفيز, to the subthalamic nucleus and release glutamate into the globus pallidus interna. And this will enhance the GABA releasing اللي موجود هنا into the thalamus. Now the thalamus is inhibited because it received the GABA molecules من globus pallidus interna. And it's no longer releasing enough glutamate back to the cortex. For the aftermath is decreased motor activity. I hope this makes sense. If you want me repeat, عادي ما عندي مشكلة. إذا واضح, we can move to the next slide. تمام. So the functions, to put it simply, there are two important capabilities of the brain when controlling movement, and that is to determine how rapidly the movement is to be performed and to control how large the movement will be. For instance, a person may write the letter A slowly أو ممكن يكتبونها بسرعة أو ممكن they write a small A on a piece of paper بس ممكن يكتبون capital A على سبورة واللي يتحكم في المعايرة هذه is the basal ganglia. When such an important part of the basal ganglia is affected, it leads to disruption of the controlled movement that we are familiar with, leading to different presentation depending on the structure that is involved. So if, for example, we have a lesion, let me quiz you here. If we have a lesion موجودة في indirect pathway, اللي هو, let's go to it. إذا كان عندنا indirect pathway يسوي لنا decreasing of the motor activity. إذا indirect pathway تعطل. What do you think the result would happen? A pathological result to a lesion في indirect pathway. يصير العكس. فinstead of having decreased movement, بيصير movement uninhibited, and it will be hyperkinetic, meaning we have excess. Say we have a lesion affecting the direct pathway. What do you think would happen? Direct pathway اللي هو كان excitatory. على نفس السياق. Exactly, hypokinetic. Thank you, Abdullah. It will lead to presentation either with Parkinson's or there are some drugs that cause this. واحد اسمه MPTP, which is a chemical compound that leads to hypokinesia. تمام. احنا عندنا هنا a couple of presentations like chorea, athetosis, bilismus, dystonia, hemibilismus, tardive dyskinesia. كل هذه الأشياء, these are not diagnosis. Unlike مثلا Parkinson which is a disease. هذه لا presentations signs نشوفها. Wilson's disease however it's grouped هنا لأن it's a metabolic disorder يصير فيه accumulation of copper. يصير الشخص غير قادر إنه يعني الجسم نفسه غير قادر استخلاص الكوبر من الجسم فit accumulates في الليفر it accumulates في البرين leading to lesions في indirect pathway يصير عندهم hyperkinetic movement أو sometimes chorea. So Wilson might present with chorea. تمام. It's worth mentioning because we need to exclude it when we do our investigations لما يجينا شخص عنده involuntary hyper movement. Okay. Let us learn more about a couple of cases لأن Parkinson will be discussed in depth in another lecture by a different tutor إن شاء الله. فخلنا نقرأ تعريف وارتباط كل شكل من الأشكال ونشوف مقطع بحيث توضح وتثبت الصورة أكثر بإذن الله. For instance, say there was a lesion for globus pallidus. It will lead to spontaneous or continuous writhing movement of the hand, the arm, the neck, or even the face. Writhing كأن اليد تتلوى، أصابع تتلوى حول نفسها. We call this athetosis. Let's take a look here. As you can see here, it's twisting. The fingers are twisting, a wrist is twisting, even the arm, it extends all the way to the arm, sometimes in severe cases. And that's with the globus pallidus lesions that lead to athetosis. While a lesion, the subthalamus, it may lead to a sudden flailing movement of the entire limb, and we call that hemibilismus. أحياناً تكون bilismus إذا كان كل الجزئين اليمين واليسار، هم إذا كان بس نص. Well, let's see how that appears in a case. As you can see, هنا في hemibilismus of the lower limb and the upper limb. It seems to be as if they're throwing their whole limb outward, and it's involuntary. تمام. لما يصير عندنا a couple of lesions في الputamen, it would lead to a flicking, irregular flicking motion of the hands, the face, to other parts of the body. And we call that chorea because if it has this dance-like pattern. Let's see here. You can see this flicking or tapping like of the hands and of the feet. And the feet, yes. السلام عليكم. الصوت والصورة واضحة؟ I apologize, had some technical issues. بس we're back. So خلنا نعيد النقطة هذه بس. عندنا قلنا لما يصير عندنا lesion للputamen that will lead to flicking movement للhands للface ونسمي هذه chorea. وتشوفنا كيف الحركة. بس خلنا نشوفها وهو يمشي عشان تثبت الصورة أكثر. As you can see, he seems to have this dancing-like motion. But remember that it's involuntary. تمام. لما يكون عندنا lesions في السبستانشيا nigra وهذه طرقت لها حنين, it will lead to a common, actually a disease that's common في المملكة العربية السعودية that presents with a triad of rigidity, يكون very stiff, akinesia or hypokinesia, poverty of movement, and tremors, and we call this Parkinson's disease. Let's take a look here. As you can see, he's finding difficulty initiating the movement or continuing حتى معاها. هنا في حركة that is a clinical sign we see with the Parkinson's gait, and that is turning in a box. When someone walks, we have them walk يمشي بخط مستقيم بعدين يلف على شكل U. Parkinson's patients, they turn in the same spot اللي هم فيها, وهذا بالحقيقة خطر عليهم لأن أحيانا ممكن يقعون على وجههم. As you can also see here, we have a mask face or a poker face. Lack of motion of the face, facial expressions. We can also see a phenomena that we call short steps that improves, or freezing of gait that improves with visual cueing. As you can see here, ما نحطوا هذه السترايبس الملونة، أو أحياناً لما يحطون شيء بارز على الأرض مثل علبة منديل أو ما شابه. their visual يعني visual cues هذه تساعدهم في إنهم يأخذون خطوات طبيعية as if to improve their gait. وهذه يعتبرونها يعني يستعملونها في الفيزيكال ثيرابي as well عشان يدربونهم يرفعون رجلهم بدل ما يمشون يسحبونها وتصير خطوات بسيطة عشان ما يطيحون. And that's a phenomenon called improvement with visual cues. تمام. Last but not least, sometimes we see tardive dyskinesia, and that's a side effect of some neuroleptics medications وبتاخذونها في الأسبوع الجاي إن شاء الله. مثلا anti-schizophrenia, for example. And these block the dopaminergic transmission. They don't affect the structure, they only block the chemicals responsible for it. And let's take a look here. Some patients appear with tapping motion of their fingers, some appear with chewing motion or licking of the lips. As you can see here, she's tapping her fingers, and there is smacking and chewing like motion of the mouth without anything يكون داخله. And that's tardive dyskinesia. ممكن if with يعني تعديل الدوزز تخف الأعراض هذه. تمام. نرجع لحالتنا هذه. Does anyone want to read? Can anyone unmute and read it? وإذا لا عادي I can read it. يعني مو مشكلة. I don't know if you guys have microphones or not. بس تمام خلاص مو مشكلة. So احنا تكلمنا على خلينا ناخذ الأشياء المهمة هنا في هذا الكيس سيناريو واللي ما يعني needs a reminder. Here it is. So this person had developed uncoordinated movement that is involuntary للtrunk and the right arm. So a trunk اللي هو the chest and the abdomen, and it was sudden, vigorous, and aimlessly be thrown about تطيح أي شيء بطريقها. الحين what is the name of this clinical sign? إيش نسمى مصطلح لوصف هذا الشكل؟ And I can go back لل terms and definitions. Oh, awesome. Okay, Dr. Abdullah جابها. Hemibilismus. Now, this clinical, I hope the other students as well يعني agree to this. بصير يعني أديت مهمتي الحمد لله. Okay, this sudden onset is due to a vascular impairment, either hemorrhage or occlusion. لأن as you can see من past medical history, it was secondary to cerebral hemorrhage, this right-sided hemiplegia. ولما يكون عندنا presentation of someone with right upper limb hemibilismus, we think about the damage being the left subthalamic nucleus or neurons connections. That will lead to this presentation. لأن it's contralateral عشان the connections they cross. Another tip, إذا مثلا okay صار عندنا هذا presentation بس المكان مو في right upper limb كامل ممكن في اليد بس, and it's not as vigorous, that will be athetosis. لأنه يكون غالباً يكون للديستال while البليزمس يكون للبروكسيمال. تمام. هنا a couple of helpful summaries I found من AMBOSS as I was preparing for the presentation. You can check it out لما يوصلكم الإعراب إن شاء الله. That's another one. نفس الكلام اللي عندنا بس ملخص. Thank you for your active listening. أشكركم, واللي عنده أي سؤال حياه الله. وبس والله أحسن المحاضرة كانت واضحة إن شاء الله. That's it from me. صراحة ترى أذكر أول ما درستها كانت من أصعب المحاضرات in medicine. لذا ما هان عليه أتركها نفس ما هي. وإذا أحد فكر بسؤال بعدين, this is my email. You can just email me anytime. وإذا أحد حاب أرجع لنقطة أو شيء معين، بالعكس حياكم الله، هذا وقتكم. Thank you so much. With regards to the recommended references, I would suggest going over sources اللي موجودة في slides and see what fits your style and learning the best. وغير كذا بالتوفيق إن شاء الله. شكرا لكم.